right, thanks, Chris. If you're worried about whether too much coffee is bad for your heart, fear no more. Research funded by the British Heart Foundation found drinking up to 25 cups of coffee a day is no worse for your heart than drinking less than a cup each day. Previous studies suggested drinking coffee can cause arteries to harden and could lead to a higher risk of a heart attack or stroke. This is the best news I've seen all day.
100%.
We're taking your calls today for Dr. Zorba Paster. We have 2 lines open if you want to give a call.
That's right. That number 270-9933. And we have a number of calls already. Let's say good afternoon to Dr. Zorba.
Hi, Zorba.
Paster. Yeah, it's good to see you.
Good to see you guys. I do not drink 25 cups of coffee a day.
Contrary to popular belief, right?
I'd be like this. Right.
No, I don't either. I love it, as I talk about all the time, but not quite that much. Okay, let's go right to the
25
phones.
cups.
Since people are waiting to talk to you, and we'll start with Linda in Janesville. Hi, Linda. What's your question?
Hi. Well, I was told about 5-6 years ago by a doctor that my feet are arthritic and I've got lumps on them and they're very painful and it's getting worse. What possibly could be done?
Well, first of all, it's hard to say exactly what you have in terms of arthritis. You could have gout, because gout would produce something called tophus, which are the swelling that can occur in your feet, and then a drug that basically reduces the uric acid in your body will help with gout. Could be from rheumatoid arthritis, a bunch of other things that can actually cause swelling in the feet. One of the best things you can do is go back to a doctor, get a diagnosis made, get an x-ray of your foot made to see exactly what you should do. But I think you've got painful feet and you've got swelling and you don't have a diagnosis, you need one for sure.
Okay.
Absolutely. Yeah. Let's go over to Jeannie now from Prairie to Sac. Jeannie, what's your question?
Jeannie, are you there?
Yes.
Go ahead. What's your question?
Hi. Hi there. I was wondering, lime in your water, is that dangerous for cooking or in fact for putting it in baby's formula?
So what in your water? I didn't quite get that.
I think it's lime.
Oh, lime in the water. Well,
Yeah.
first of all, if you're going to be giving water to a baby, especially if it's in well water, you want to get it tested. You want to get it tested for nitrates and see if it's safe for your baby. That's totally different than for adults. Pretty much for adults, they can tolerate a lot in their water, and lime in the water should not produce any trouble. But once again, the county will actually test the water and see whether or not it's safe for drinking. When in doubt, get it tested for sure.
All right, very good. Let's go to Terry in Oregon. Hi, Terry. What's your question?
Hi, good afternoon, doctor. I was diagnosed with Lyme disease a couple years ago. I was lucky enough to have it cured by the shot antibiotics. Do you develop any kind of antibiotics to it once you have it?
You mean a resistance to it?
Once you actually have Lyme disease, if you get the appropriate antibiotics, you're cured from Lyme disease that time. But you can be reinfected, just like you can get strep more than once. You can get Lyme disease more than once. And basically, if there's any doubt about it, go in, get a Lyme test, and see whether or not you have it again. But once you're actually cured, we don't check for the cure, because there's really no way to check to see. We just assume a course of antibiotics will work as long as your symptoms have gone away.
Yeah, it's good to hear right there. All right, let's go to John in Madison. John, what's your question?
I'd like to find out what causes fatty liver.
Eating too much food generally is what causes fatty liver. It's basically a result of diabetes for the most part. People who are diabetic often get fatty infiltration of the liver, as it's called, but also people who are overweight are much more likely to have it. It's a problem with the food we eat and the amount of food that we eat. And when you get it, there'll be an abnormality in your liver function test, and you can actually get a hepatitis, a swelling of the liver. So it's very important often for the treatment of fatty liver to lose weight, to exercise, and to just really eat a better diet.
So it is something that's reversible. You can help yourself by changing your diet.
You bet. It is something that is treatable. It may be partially reversible or completely reversible, but it's definitely a lifestyle issue that has developed. Right.
Okay.
Yeah, good to hear. Larry over in Dodgeville. Larry, are you there?
Yeah, I'm there.
What's your question?
I got a sleep problem. I wake up every couple hours on the hour. I can't get slept out. I got osteoarthritis and fibromyalgia, and I've had sleep apnea studies and CPAP machines, and nothing seems to be working. I'm wondering what the next step is.
Well, if you've got osteoarthritis and sleep apnea, one of the first things you want to do is, and other medical problems, is have somebody, a doctor, certainly a pharmacist, go through all your meds and see whether or not any of your medications are interfering with your sleep. Some medications actually, such as over-the-counter decongestants, will actually wake you up. So you want to look at your medicines first to see if that's part of the problem. Then, if there's nothing in the medicine that's keeping you awake, you want to look at some other safe things to actually take to help you sleep. You want to look at something called sleep hygiene, getting your room sort of all set up and so on. But there are medications that can be used that are safe. A drug called gabapentin, which we commonly give for chronic pain, is very good for sleep. Another pill called doxepin, which is an antidepressant in very low dose, will help people sleep. But it's something you really want to get evaluated in total to see what you're doing, what your medicines are, and how you can sleep better.
Sleep is so important, and it seems so elusive for so many of us. Yeah.
You bet. You bet.
That's all the time we have today for your calls. Thanks, everybody, for calling in. Zorba, great to see you.
Great to see you guys.
We'll see you again next time.
Yep.
And we'll be right back.